Liftoff of mission 41B, first flight of the orbiter Discovery, and the shuttle has cleared the tower.
Hey, what's going on, you guys? Hope you're having a great day. Welcome back to the Health or High Water podcast. We have a good episode for you today. Dr. Amy Pearson, what is going on? How are you doing today?
Great. How are you?
So good. Thank you so much again for taking your time. Appreciate it.
Thank you for having me.
This is going to be fun. We got Leslie in the building. What's going on, Leslie?
Just here for this.
Okay. You got some questions? Trip said that you were really extra excited for this episode.
I'm extra excited about this episode because what do you guys know about women?
Well, this is great because we're going to actually have a...
This is an educational session for Brett and Trip.
We
can learn today.
That's good.
This is
More
good.
men need to learn about women's health.
Yeah, women's health is important. Men's health is important too.
Absolutely.
Not as much.
It's different than women's
well,
health.
not as much.
There's
Very different.
Different issues we each deal with for sure. There are some similarities, but yeah, and you focus only. Do you work with men as well?
I do.
Okay.
Yeah, I do work with men.
Okay.
Our main population is women. We market to women the most, but I do have some private patients that are men too. Yeah.
Gotcha. Okay. Mr. Trip Parks over there producing. He's twisting knobs. How you doing, my friend?
I'm doing good, man. I came off a Thanksgiving weekend. Just kind of thrown into it this week. We got some leaf blowers and people mowing outside, and that's as a producer, it's making me kind of tweak a little bit.
The right side of his face is twitching.
This is literally the bane of my existence. Editing this is going to be so much fun.
We'll figure it out.
Yeah, but some cool news. We're starting at some new communities for our boxing class for Parkinson's, which is awesome. Starting here at Cavid. Been over at Koya here for a few months, doing a great job over there. Brett's been playing some shows. I've been trying to help where I can with musically, if I can ever remember lyrics to a song. And then I just hope all the listeners out there have had a really great holiday. If you guys are into Thanksgiving. But if not, you guys should partake in Thanksgiving, at least a meal.
I was going to say, who isn't into Thanksgiving?
I love it. I
don't know.
Turkey, mashed potatoes?
I gained 10 pounds, and I'm not exaggerating. 10 pounds in the last week. I just stepped on the scale.
Tis the season. I
was going to say, were you around your mom?
She
There you
made
go.
an extra batch of chocolate chip cookies.
That's what moms do.
She is the best. My dad's like, who ate the cookies? I'm like,
nobody.
Chocolate all over your face.
Right.
Like, I don't know.
Not me. Not me. So Health or High Water podcast, we like to talk about, like, dive into different perspectives on some of this stuff. Some people in the community that are difference makers, quote unquote, that are out there doing it, that are working with individuals that are seeing some of this stuff going on. You have your own practice right now. How's that going? What are you focusing on? What's like the focus right now for you?
Yeah, so in my private practice, I would say the majority of the people that reach out to me are going to be a very similar story across the board, which is, I know something's wrong, I don't feel great, I know my hormones are off, but my gynecologist says everything's fine, or my primary care says everything's fine, but I don't feel like everything's fine. It started, being a female as a patient and also a provider. It started with my own story of knowing something was wrong and not feeling great and having my primary care say, well, everything's fine. But I knew something wasn't fine. And so that took me down the rabbit hole of functional medicine, digging deeper to get to the root of what is really going on that's then having, an effect outwardly to hormones or whatever it may be. Autoimmune conditions, gut health, you name it. We do all of that. So most of the time it's just that same story. And that's not to mean that every story isn't unique and individual. But I get a lot of the same story coming in as far as I know something's wrong and I just don't even know what to do anymore about it. So
where to even start with it?
Yeah. Yep.
What was medical school like for you? Were you a good, super easy learner, like cruise through it?
No, it was terrible. It was
Give me
so
the
very
dirt.
hard. My background is actually in chiropractic. And so that's how I started. And then I had my diplomate in pediatrics and maternal health. And so I was exposed to a lot of women in my practice and always wanted to kind of focus more on women. But, when you're in the managed healthcare system, you have only a certain amount of time. You can only do what the insurance companies allow you to do. And then after an injury, I went back to school and got my functional medicine certification, and now that's all that I do. And so school in and of itself, I would say chiropractic school versus medical school, we get a lot more in depth with nutrition and stuff like that, which is really awesome for functional medicine. But it's 4 years, it's 4 parts to the boards, it's 8 to 5, 8 to 6 of school every day, Monday through Friday. And it's very, very intense. We actually have more credit hours in the books than medical students do.
Wow.
Yeah. So
when did the functional medicine come into play? Just a gradual part that was happening, or?
No, it was, so after I had an injury and had to have reconstructive surgery, my own health started shifting, I guess you could say. So I went to my primary care, and she was like, well, everything's fine. I'm like, well, I'm working out twice a day. I'm eating keto and I'm gaining weight and I don't understand. Right.
Yep.
And so that then,
is fine.
right.
Yeah.
Yep. That took me down a rabbit hole that started with thyroid, and then it just kept going. And then I got my gut health certification, and then, it was another 2 years of study, but it's always constant ongoing study because everybody is different. There's a lot of research that has to be done for each patient because of the level of depth that functional medicine goes into. So it's constant.
Can you touch on gut health? It's more of an issue? I mean, I know some of my friends and men who have it too, so it's not exclusively women, but
right.
Is it true mostly women? Is that more of a female issue? Why is it an issue? And do you do a ton of gut health now?
I do. I mean, I feel like even though the majority of women that come to see me want to talk about hormones, and that's their goal, hormones are converted in your liver and your gut. So if your gut isn't healthy and you just try to focus on balancing hormones, you're swimming upstream. It's just not going to work as effectively. Your gut is your root of everything. Immune system function, everything. So, yes, I feel probably men and women across the board have similar gut concerns, and I think that's just part of our society that we live in, right? Our diet, our stress levels, etc. But women, hormone fluctuations can impact gut as well. So I'm not going to say this as a factual statement. Maybe it's just because I see more women than men as patients, but I do feel that women have more gut issues than men, typically speaking. And I think part of that is just how women process stress versus men. Our hormones are a lot more complicated than men. Childbirth, things like that all can affect your gut microbiome.
Yeah, and you mentioned the stress too. So there's a lot of different tests you can do with gut health, right? You can go in and there's a lot of different ways you can start to figure out, is that part of the process you're using? Okay.
Yeah. I always start with testing because functional medicine is so specific and individualized, you really need data to work with as far as then knowing how to proceed and go forward to correct whatever. So I always start with test. A gut test, a microbiome test is one of them that I would say 98% of my patients do, along with a very deep dive hormone profile and some blood work. And those 3 are usually my go-to. Now, not everybody has to have all of those, but those 3 are usually my go-to right off the bat before we even talk about moving forward or working together. I need data in front of me combined with subjective findings. What is the patient telling me? These are my symptoms, this is my lifestyle, etc. Let's pair that with the data, and then from there we can formulate truly your best customized plan.
I love that.
Thanks.
I'm firing so many questions at you. They're
That's
just
okay.
As they go.
That's
Are you
okay.
ready for another one?
I'm passionate about the topic, so
I
it's
know.
all good.
I was going to say,
yeah.
jump in, by the way, you guys. Let me get
I'm
one more.
fascinated here.
Let me get one more.
I love this.
So scope of practice, I think, is important as a medical practitioner or any practitioner in this field. How do you feel about that? You obviously have a ton of experience in different areas. How does that relate to what you're doing? Are there certain areas where you're like, hey, I want to recommend you to this person?
Oh, absolutely.
How do you draw that line?
Yeah, absolutely. Even though functional medicine really does look at the individual as a whole versus dividing it up into specific symptoms or specific body parts, like typically the traditional healthcare system does. So it does get really complicated. one of the best pieces of advice when I was doing my internship with an MD who had been doing functional medicine for quite a while, before it was becoming more popular, she said, you can go down a rabbit hole in so many different directions. There's never going to be an end point. And so you really do need to kind of pick an area that you're interested, focus on that. You're still going to cover a lot of areas, right? Like I do autoimmune conditions and all kinds of stuff. I will do toxin remedy, whether it's mold toxicity or environmental toxins. I will do all of that. But I am not necessarily a specialist in those areas or like Lyme disease or some of those others. And so absolutely I'll refer. But in my second business as well, I have a network of other specialties. And so we all work together to try to formulate really the most optimal customized plan that an individual might need. So that could be a therapist who specializes in trauma. It could be personal training, that specializes in pre and postnatal. It could be lactation consultant. It could be primary care, pelvic floor therapy, whatever. And so it takes a village. No one provider can do it all.
Can you tell me more about it's called the Women's Health Network?
Women's Health Institute.
Yeah. Okay.
Uh-huh.
Can you tell me more about that?
Yeah.
When it started and all that?
Yeah. So I formed the company it'll be 2 years in January, and I haven't done a whole lot with it yet because, when you quit your full-time job, then it's like, okay, let me get into survival mode first, pay my bills, then I'll build the other thing.
We know.
So yeah. But it's happening right now. I'm in the middle, almost finished with a big rebranding project. I also just am in the process of filing a nonprofit entity with it as well. So what it is basically a collective of independent female providers that works together, like I was just explaining, to formulate a customized care plan for an individual patient. What I really wanted to create was something that eliminated the burden off the patient as far as trying to figure out who they need to see, transferring their records, who do I call, where do I even begin to know what I need. So to try to eliminate that burden, but also from a provider perspective as well, when you leave the managed healthcare system, it's great, right? Except you get very isolated. And so you lose that sense of community of bouncing ideas off of other providers and things like that. So I wanted to be able to create something that from the provider perspective, we can still maintain our own independent autonomy, but yet you have a community and a network to work together with for this patient. And so the patient will sign one records release form, one HIPAA form that anybody that they work with in the network, they give permission for us to share notes, talk, et cetera, to really formulate what we call a healthcare map. And that healthcare map will change over time based on needs and the stage of life that an individual is at.
I love that's so
that.
yeah,
Thank you.
that's
Thanks.
fantastic.
Well, just battling with my mom and stuff and health issues with her. And I'm like, okay, your general practitioner is not talking to the guy at the ER. And I'm like, are any of these people talking to each other? They're not. They're absolutely not. And they don't know who's prescribed what medication or what she's on. And it's messy.
Yeah. It's messy and hard. Yeah.
It's been that way too for a long time.
Mm-hmm.
Yeah, in the good cases.
Everything's just reactive.
Yeah, that's for sure. Trip always talks about that too. And you say it so much better than I do. Can you talk about the segmented market real quick?
Well, it's what I found when I was taking care of my mom was, like, everyone's talking about this, no one's communicating. I got a physical therapist that's coming to the house. She's doing one thing. I've got a nutritionist coming here. I've got a GP over here. I've got her, like, all these different doctors that are trying to be reactive to a stroke that's going on, when really we need to be reactive and come up with a way that everything comes together. Hey, your nutritionist is talking to your personal trainer. Your personal trainer is talking to your massage therapist and chiropractor, and they're continually doing notes. You're getting constant blood work updated. So segmented market as well. It's, I like how you say it's you're individualizing these programs, because you go to 5 different personal trainers and you're getting 5 different answers on how to get fit. It's frustrating to everybody, and then everyone winds up in this hell loop of getting motivated. They try something new, they find a new internet trend, they try it for 21 days, don't see any results, and they double back down to what they did. Yeah. So that's what I mean by, this industry is so segmented, but it's all meant to be put together.
Yeah, and you meant proactive, not reactive. But I know what you're saying.
Tomato.
I knew what you meant. I knew what you meant.
Real smart till that point.
No, for sure. So the Women's Health Institute. How long has this been a thing?
So I started it almost 2 years ago.
Okay.
But we haven't officially, it's launched, but I haven't done a whole lot with it yet, and that is what is in process now. So come the first of the year, we're looking for space. We want to get an actual community going and, a physical location, because right now everybody's just kind of individualized wherever they are.
For sure.
And so we're trying to build the thing.
Yeah, that was my next question. Was the difficulty of this? What problems you have run into maintaining autonomy, right? Like people feeling like they have their individual creative, realm to do their thing, but also collaborating. Because I think if you can create that collaborative environment where people feel safe to bring their ideas and be like, hey, what do you think about this? The growth just happens.
Yeah, absolutely.
So you're in the where are you looking at? Do you have a place yet you're thinking about?
There's not a specific area of the Denver metro areas where we're looking, but there's not necessarily a specific neighborhood.
Yeah.
It really comes down to certain characteristics of the area. So visibility, what is around, what's the building look like, ease of access, parking. So we've been looking DTC, maybe Highlands, maybe Cherry Creek. So I've been looking at space now for a couple months, and it's going slow.
I remember
because it's got to be the right thing, and that's the important part that I'm trying to focus on. We're not under a time crunch.
Yeah.
I want it to be right. It's not like we have to be in a space by this date. It's more like I want it to be right. Yeah. Mm-hmm.
So you have 2 younger brothers, younger than you. Okay.
Yes.
Where'd you grow up? Are you from Colorado?
I grew up in Nebraska, and then in college I transferred schools to the East Coast, and I was on the East Coast in Connecticut and New York for 23 years.
Okay.
And then I moved here during COVID.
Okay. What brought you out here?
My family's all here now.
Oh, okay. They came out before you?
Yeah.
Okay.
They did.
They're like, come on out.
Yeah. As you get older and your parents are getting older and the family's expanding, it's like, maybe it's time to be around them again. So.
Oh, that's amazing.
Yeah.
I love this. I moved here 3 years ago, and I couldn't say enough good things about Colorado.
Yeah.
It's amazing out here.
It's been good. I was living in New York when COVID started, and so that was
not fun.
Like a zombie apocalypse. I don't suggesting moving across the country in the middle of a pandemic, but I miss being there. I don't miss living there. I love my life in Denver.
Yeah.
So it's been good. Yeah.
I'm a native, so to me, nothing is better than Colorado.
Yes.
I'm like, I'll go visit other places, and I'm like, and then you get off the airplane in Denver, and I'm like, oh, home.
I didn't know you were a native.
I'm
Oh,
a
okay.
native, yeah.
Oh, wow.
Yeah.
I didn't see the bumper sticker.
I know.
Burn. Just kidding. I love you, Colorado. So why fitness and health for you? Why? What was it that the injury that happened? Like, what is it about this whole thing that was it as a kid? Like,
yeah, I played volleyball in all the sports growing up. I played volleyball in college, and then I always wanted to go to medical school and was discouraged from doing so, and then had an injury from volleyball. It wasn't a bad injury, but went to a chiropractor because one of my friends said go, and I said, what is that? So I went, and in 2 visits, the pain I'd had was gone in years. So then my focus was sports medicine, but I was really drawn to women's health, and the pediatric portion just kind of happened based on where I was working at the time. And I love that as well. So I did a lot of sports med just because that was my background, and then fell into women's health based on my own story. So
that's interesting.
sort of ties together.
Yeah, I know it does. With the chiropractics, there's a lot of chiropractors are everywhere now. They're like it's like trainers. Like it's such a big industry. It's huge. And I've heard lots of stories about similar to you said. Like I got out of pain. My question is, I've seen a lot of chiropractors now switching into functional medicine or like into that. Why is that? Is that just part of the natural progression of it? There's some people out there that say some things about chiropractors saying, it doesn't work. And then obviously there's tons of stories. So what's your thoughts on that and where that's going?
So I don't do chiropractic anymore. I solely do functional medicine. But like with any profession, there's good and bad, right? I think that one of the beautiful things about chiropractic is there is an art to it, and I think that's also in medicine. But that also can be part of the curse of it, because with the art, it's not necessarily black and white, right? There's some gray. There's some people do things a little bit differently, and it might work great for this person. It might not work for the next person. But that's like even medication, right? You go in, you get put on a medication. This is what we use. This is typical, and it doesn't work for you. You might have to find something else. So as far as the transition to functional medicine, I think a lot of chiropractors are going into functional medicine more because it really is a natural flow of what a chiropractor is really all about. And that is to assess the body more as a whole picture, not just break it up into symptoms and fix parts. Like I had mentioned earlier, in chiropractic school, we get a lot of nutrition. I mean, we get a lot of radiology. We get a lot of things. But there's a lot more nutrition than, say, a medical doctor will do. But
Which
at the
sounds
same
crazy
time,
to me.
you would think, right?
Yeah.
Yeah.
Food is
They
medicine.
don't get a lot of
Food is
that.
medicine. So like your nutrition really,
It's so crucial.
Why they don't focus on that.
Yeah, because
Makes no sense.
the pharmaceutical industry,
Well,
you don't make money when people are healthy. So, but
They just make us sick. And now we're going down the
Right.
rabbit hole of,
Yeah, I
Yeah,
think that goes back. That goes back. I mean, I don't have anywhere near enough the time to talk about like the history of the American Medical Association.
That's a whole nother podcast.
Yeah, that's a whole other podcast. But it's a fascinating podcast, and
series.
it would be actually we might have to put an episode on it. But there's a history of and then the history of the pharmaceutical industry and kind of the machine-like, and I think where we're at now today, you could probably shed some incredible light on being in the midst of it and why you went to functional medicine and that whole transition for you.
Well, it almost feels like Colorado is a pretty decent place for that because we are much more outdoorsy. We are much more like into working out and fitness and nutrition and things like that. Well, some of us. I'm not going to say all of us. But yeah, it almost feels like a natural place to be for it because some areas you're not going to.
And what I'm seeing, which is really encouraging, is the demographic population of my patients is getting younger and younger and younger. More of the younger people, younger women are looking for answers outside of just being put on birth control pill or wanting to get to the bottom of their health before they get pregnant or think about wanting to get pregnant. And that's really encouraging.
We're seeing that too. We're seeing that too, big time.
Talked about. Like you really, like what happens to your body after you have a baby, that is not a discussion.
Or miscarriage
my mother or grandmother or anybody ever had. And I'm like, what do you mean this is happening to me? And it wasn't until my second son, the doctors couldn't get me in, so I was working a lot more with like midwives, and there was just I was like, oh, this is a little bit more comfortable. It was like, okay, we'll try this and try that and do this and do that, whereas my OBGYN was like, oh no, you shouldn't do that. But the midwives were a little bit more, it kind of made me...
For us dummies, what's a midwife?
Oh, I couldn't give you the technical term.
They assist in deliveries. They have their own special training. They're not a physician, but their job is to assist in delivery. So whether that's actually delivering the baby or just being part of the team that helps assist the mom in delivery is what their job.
Through university, and so I had an OBGYN and a doctor, but when I would go in for all my wellness checkups and everything, and baby checkups, it was with the midwives because the scheduling was so ridiculous. They're like, well, we can get you in with the midwives. I'm like, okay. Like, I didn't
And they tend to be a little bit more in tune with like what the mom's body wants and what's going on in a more natural perspective versus just such medical intervention. And I just want to say, this is not to knock the medical community, right? There is a time and place for everything. There is a time and place for medication. There's a time and place for surgical intervention and C-sections and all the things, right? So I just want to make sure that I state that this is not to bash the system. I mean, I think everybody knows it's broken, but there's a time and place for everything. And I think that's also too why more medical doctors are transitioning to more of a functional medicine approach as well. A little bit again, everybody does things a little bit different. They still use a lot of pharmaceutical interventions, I've found in my experience. That's just what they know. But they are also trying to use more nutritional avenues and supplemental avenues and kind of more of a healthier lifestyle approach as opposed to just pushing medications all the time.
Interesting. I got a tough one for you.
Oh, gosh. It's Monday. Be gentle.
Oh, it is Monday. It is Monday. Okay, what's your favorite color?
Depends on the day.
I'm feeling blue today.
And which hormones have hit my bloodstream.
I didn't even have lunch
Let's
yet.
see. Right now it's red. Okay.
Right.
This is the last really serious one. So positivity and mental health, people or anything, it tends to be a representation of its environment. So people, us, people, human being in society, we obviously have our own struggles now. I think we all see quote unquote great awakening. There's a huge health movement right now.
Yep.
Much like yourself, there's a lot of doctors that are now becoming natural practitioners. Nutrition is becoming, there's a bigger push now for nutrition to be in, training for doctors. There's a lot going on. The question was, how does positivity and mental health play a role into all this? I know I guess we can all agree how extremely important it is, but we can't quantify positivity. We can't quantify mental health. Is there something you do, or how does that work with your approach?
Yeah. Well, depending upon the level of mental health that is needed, right? So if it's someone that needs to work with a therapist specializing in trauma, for example, or someone who comes in and they're already on medication and need their medication managed, or if it's just, I have a lot of stress in my life, maybe it's my marriage isn't great, or I'm going through stress, whatever it may be. Stress, on one of the tests that I run, there is a diagram that outlines it clearly how stress affects our whole physical health system. And particularly something that I put a lot of focus on is our adrenal system, okay? Our cortisol, our DHEA. Our HPA axis, which stands for hypothalamus, pituitary, and adrenal glands, form what's called the HPA axis, and I call that the mothership. And the reason is almost every hormone in our body originates there, somewhere, somehow. And so when stress goes into the brain, it's going to have a big effect on our adrenal system, which is going to have a downstream effect on all of the other hormones, which is going to affect pretty much every capacity, everything in our body. So making sure to address stress, meeting the patient where they're at. There's some things that you can't, I'm not going to say you need to get a divorce and that's going to fix all your problems. Quit your job and everything's going to be okay, right? So
Live in a van by the river.
Right, exactly. You can't say that. So testing the adrenals, see what they're doing, supporting the adrenals as much as possible, but then also talking about those lifestyle components. That's what I just mentioned to Trip earlier there.
Yeah.
Sprinkle moments of Zen throughout your day. If you're someone who has a desk job at a computer, like so many of us are now, get outside for 5 minutes and just take some deep breaths. When you are driving in your car, you could do a box breathing exercise, right? Inhale for 4, hold for 7 or 8 seconds, exhale for 8 seconds. All of those little things will add up to help kind of reset and heal the adrenal system, which will help us to decompress. But it is an epidemic, and it is such an important part of our health. Stress is one of the main components of disease, right? Stress, it's dis-ease. That's why it's called that for a reason. So what is really encouraging is that there are so many avenues, and mental health is being addressed a lot now. But at the same time, I think there's so many people, and I will say women especially, just because that's, who I work with the most, we take the weight of the world on our shoulders. We're juggling so many things, and yet our hormone system is so much more fragile. And so it is something that is stressed and touched on with every single patient. And again, depending upon the level of care that is needed, we offer those resources as well.
It sounds like, to me, education then is such a big piece. Is
Huge.
Learning, oh, that's why I'm stressed. Okay. And just kind of getting that piece.
Yep. Talking about good sleep hygiene and, everything that stress can affect, even if we can't change your job or fix your marriage or whatever the situation may be, how can we give you tools to try to cope as best as possible?
Yeah. Yeah.
Well, I know we're getting kind of close to the end here. I really like what you say about how stress affects everything. Because I want shout out to Dr. Browning in Virginia. He's the first person I ever went to that was a chiropractor that talked about my adrenals, and he was like, "You are just all sorts of messed up with cortisol," and got me realizing down that rabbit hole of how all these different parts interconnect. If your sleep is faltering, your workouts, your focus, all this kind of faltering, how they're all connected. Last question before we have to kind of close off here. Where do you see health and wellness going in the future? What are some trends that you like?
Yeah, I'm very optimistic for it. And again, one of the reasons is because my patient demographic alone, I'm starting to see younger and younger women, patients in particular, just in general, that are looking for other avenues. They're a lot more educated. There's a lot of information out there, which, is good and bad.
Right.
What's good information and what's not so good information. Particularly in women's health, there is a huge movement happening right now. And it's already a $3 trillion industry that's kind of just getting started. The other piece of this that I'm hopeful for is particularly what I would like to do through Women's Health Institute is the more we can educate women on other avenues to feel better, get better. Women typically make most of the health decisions for their family. Right. And so if they're learning and making changes, they're going to teach their kids. And my vision is that we can change our healthcare system in general if we just keep going and doing what we're doing. The younger generations, then the kids, and they're going to be going into their health having this information already, if that makes sense.
No, 100%. I love that.
Leslie, final thoughts from you?
I do make all the decisions. Yes.
Well, I was going to say you're a great example.
Yes.
Well, it's very true.
You're a great example of this.
Yeah.
My husband will say, "Oh no, you know about that," or "You make that phone call," or that's just what I do.
You started meal prepping for your family too. That's huge.
Fantastic.
I do meal prep.
Yeah.
What else do I do? I show up here every day.
With the smile on your face. Smile.
There are days I'm like, someone got me to laugh today.
It'll be me. It's always something funny going on.
Always good energy. Thank you once again. Really appreciate it. You guys listening from all over the place. Any new countries?
They love this part of the podcast where they talk about how many countries are listening to them.
Well,
we were at like 55, so now it's got to be more.
Well, we had our first few downloads from China, so welcome to the full China.
All right.
Excellent. That's exciting.
If you guys want to
so it's 56
reach out to Dr. Amy more, you can find her on her website, Dr. Amy Pearson. It's spelled person, so DrAmyPerson.com. And you'll see all about our services. And then you can also request a consultation. And there's a lot of resources here, wellness support and nutrition and a lot more. So, go check it out. And thanks again. Appreciate it.
Thank you. Thanks for having me.
Thanks, Trip. Thank you, Leslie.
Good luck getting the leaf blower out of the background.
I'm in my head right now just like thinking about what kind of filters I have to use.
And thank you guys for joining us.
Rainwater or something?
Hope you have a great rest of your day. Take care. We'll see you on the next episode of Health or High Water. Bye.
Peace.